After a string of suicides at the Lerdo pretrial facility in 2020, the Kern County Sheriff's Office teamed up with Kern Behavioral Health and Recovery Services. They're working to better address the mental health of inmates. 23 ABC's Veronica Morley spoke with the detention sergeant behind the program about its impact.
They just need interaction, really.
Inmate suicide attempt has always been a concern, but the pandemic increased this risk with less and less interaction. Kern County Detention Sergeant Patrick McNeil noticed the impact this was having on the mental health of inmates.
So the inmates weren't getting out to interact with each other as often. Their families were no longer allowed to come and visit. I just realized somewhere along the lines that I can help these people.
In 2020, the Lerdo Justice Pretrial Facility saw a rash of suicide attempts. During one weekend in September, there were 4 attempts made. 2 were successful. Sergeant McNeil said it was after that he sent a memo requesting to start the Inmate Stabilization and Assessment Program.
We have what we call the ISAT model, where they go from acute to stabilization, and once we have them stable, then we can move them back to a general population type housing and then through the court process.
McNeil's caseload right now is around 300 inmates, with an average of 15 to 20 acute cases.
I'll keep them as calm as possible while I'm talking to them. In a low, calm voice is usually how I'm talking to them. Ask them if there's anything I can do for them. Sometimes all they need is to be later. Maybe they're tired. Maybe they're just agitated at the moment. Maybe something upset them. We'll come back later and deal with it.
Prior to ISAT's creation, the facility averaged around 5 suicide attempts a month. Since its start, that number averages 1 to 2 attempts per month since 2018. McNeil said since ISAT, they've only had 1 successful suicide attempt. The program not only addressing impacts the pandemic had on inmate mental health, but filling the gaps that were previously there.
I try to interact with all of them at least once a week. I know that if my family members were in here and they were suffering from mental illness, I would want them to be taken care of. They might be criminals, but they're still somebody's family member.
Due to staffing shortages, they're only able to do so much. But eventually, he'd like to see the program grow to better address female inmates and maintain programs and contact with inmates after they're released through behavioral health.
Is it difficult, though, when you see an inmate that was released that you worked with and had them kind of on a stable track come back falling off that track?
It is difficult, and it's difficult to see after decompensation, they never get back to where they were before. So it's a little heartbreaking from time to time whenever you spend so much time getting somebody well, and then they make that choice. They're incarcerated, they can't do anything about that. That's one of the main barriers that we have. But once I cross that boundary with them to where, hey, I'm here to help, my team is here to help, Correctional Behavioral Health is here to help you get healthy so that you can move through your court case, and then one day you won't be incarcerated.
For 23 ABC News, I'm Veronica Morley, connecting you.